right. Welcome to all of our attendees. Thanks for joining us today. And we will get started. Welcome to the Hennepin-University Partnership Winter Webinar Series. My name is Sarah Sangren, and I'm a graduate assistant with the HUP, here with HUP Director Kathy Doty and our presenters, who I am pleased to introduce after just a few reminders. We're so glad to be with you virtually today. Some points about our Zoom platform. Your video and audio are not enabled, but please use the chat function if you need any support from the HUP team. And if you'd like to ask a question, you can submit that through the Q&A button, which you'll find along the bottom of the Zoom window. We'll monitor questions throughout and have time for responses from our presenters. And this webinar will also be recorded. Please look for an email from hup@umn.edu this afternoon, including a link to a brief survey, links to the video recording of this event, and to the 2020 Status of Women and Girls in Minnesota report that we'll be hearing about today, and contact information for our speakers, who I am very excited to introduce to you now. Christina Ewig is Professor of Public Affairs and Faculty Director of the Center on Women, Gender, and Public Policy at the Humphrey School of Public Affairs. She works to stimulate research, teaching, and public engagement on gender and its intersections with other forms of inequality, and leads the center's research portfolio centered on finding evidence-based policy solutions to gender-based disparities with specific expertise in the state of Minnesota. Gloria Perez is President and Chief Executive Officer of the Women's Foundation of Minnesota, where she leads the first statewide women's foundation in the country. Through her leadership as President and CEO of the Jeremiah Project prior to her current role, she became one of the nation's leading experts in two-generation strategies to reducing poverty, and she has more than 25 years of experience across sectors from small business, for-profit corporations, to nonprofit human services. The Center on Women, Gender, and Public Policy and the Women's Foundation collaborate in an ongoing research project with a unique gender, race, place, equity lens to examine the status of women and girls in Minnesota, the topic of our presentation today. Welcome to our presenters, and I will turn it over to them.
Thank you, Sarah. I think Gloria is going to start us off with a little bit about our partnership.
Yes, thank you so much. Good morning. I'm Gloria Perez, as was mentioned, and I'm so excited to be with you here today with Dr. Ewig to share insights on our status of women and girls 2020 in Minnesota and what it means to the lives of the women and girls across the state. This report is the only leading research in the state regarding the status of women and girls. At the Women's Foundation, we have been investing in research as a foundation since our inception. And since 2009, we have partnered with the Center on Women, Gender, and Public Policy here at the Humphrey School to produce this report, which investigates how women and girls are faring in the areas of economics, health, safety, and leadership. This research is inclusive of gender expansive and trans women, representing the full experience of how we define women at the foundation. So as we talk today, we'll show how women and girls in the state face added barriers and sometimes opportunities based on the identities they hold. The report holds so much more than we're able to discuss here today, but I hope that the presentation offers a chance for you to learn more about what the experiences of living in our state is really like for women and girls across the state through the areas that we dive into today. And in this moment of the pandemic and amid the global uprising against racial injustice, we're acutely aware of how a crisis can exacerbate the inequities that have always existed at the roots of our systems. We believe that there is power in uncovering the truth in our time. We are in a time of transformation, and we are choosing to focus on actions we can take and the change that we can activate at the systems level and through policies that take into consideration the complexity of women and girls' lives. Audre Lorde said, "There is no single issue struggle because we do not lead single issue lives." And when we look at this data, we can be dispirited by the inequities facing women and girls across the state, and we can identify the incredible wisdom and the leadership that we see being held by women and girls in their communities. Women who are experiencing the impacts of systems that push them to the margins in economics, health, safety, and leadership. So through the full report, we are seeing something the research has long shown us, that the identities women and girls hold, from their gender to their race, to the place where they live, to the other realities that are part of their lived experience, greatly impacts their physical and mental health and safety and access to economic opportunity and leadership. Christina, it would be great if you could describe the role that the center has played in the report.
Yes, we've been fortunate to collaborate with the Women's Foundation of Minnesota since 2009, as Gloria has just said. And it fits very well there. I think the mission of the center and the mission of the foundation are very similar in terms of having a commitment to engaging with the communities in which we're located, and that's Minnesota. And so the Center on Women, Gender, and Public Policy, as part of the Humphrey School, has, as part of its mission, engaged research. We do a number of different things, but engaged research is important to us. And in this report, we're able to see the full array of experiences of women and girls in Minnesota on a regular basis and track to what degree we see disparities increasing or decreasing in the major areas of the report. I wanted to also give a little bit of background on this report, and we'll talk a little bit more in the next slide about our approach. And that's another way in which the work of the center and the work of the Women's Foundation intersect. And you've already gotten a sense of the intersectional work and approach that we take to this report. But a few notes on the methods behind the report. It's principally quantitative research that we do in this report, and we draw on the American Community Survey for some of the content. We also draw on the IPEDS survey for some of the educational statistics we have here, as well as the Minnesota Student Survey. For some of the childcare aspects, we use the American Time Use Survey. So, and in addition to those, we often draw upon other research that's being done by organizations in the Twin Cities area or from national level research in order to provide as full a picture we can of key disparities in our areas of interest that Gloria has already outlined. So now let's talk a little bit about the framework that does inform the research, and Gloria is going to start us off with that.
So thanks, Christina. The Women's Foundation sees how multiple identities have lifelong consequences that impact life experiences, health, economic security, life and death issues. And so using the term coined by the lawyer and scholar Kimberly Crenshaw, the Women's Foundation developed this intersectional equity framework to illustrate how the intersecting identities of individuals and communities impact their systemic access to opportunity, well-being, and equity. We know and we see in our work in the power, vision, and value in individuals and communities most pushed to the margins. Their lived experience with systems make them experts in identifying the community-specific solutions. They know best what they need. Solutions, we believe, live in communities, and the more we value and invest in their leadership, the better our solutions will be. So as a community foundation, the Women's Foundation has always centered these communities and solutions, and we're continually finding new ways to co-create, learn, and adapt in these times so that we can cultivate the conditions for women, girls, and their families and their communities to thrive. So this means transforming our systems of healthcare, education, to create greater access and opportunity for the talent and vision that is abundant in our state. And we see that using this analysis is required to create those conditions so that all people have what they need to thrive.
So the Women's Foundation's,
Go ahead.
Okay,
Nope.
The Women's Foundation's approach to this research fits very nicely with the approach of the Center on Women, Gender, and Public Policy. Intersectionality, as coined by Kimberly Crenshaw, was conceptualized. She wrote that article in which she coined the term in 1992. So it's been with us for a long time. And it really draws upon a deeper set of scholarship by women of color researchers that predate Kimberly Crenshaw. So in my own training as a social scientist, intersectionality has been fundamental to the ways in which I've approached my thinking and my research throughout my career, going back to when I was an undergraduate in college. And it does mean a focus both on individuals and on systems and structures, as Gloria has pointed out. So that means thinking about individuals whose life experiences include intersecting structures of inequality. Gender, race, and place are the ones that we focus on in this report, but also how those inequalities shape the society in which we live. And so we try to capture both of those elements as we move forward in the report that we will present to you today.
So as a result of COVID, we see women and girls being distinctly impacted by the repercussions that the pandemic has caused in Minnesota's economy. We know from our grantee partners all across the state that this is an unprecedented crisis. But given what we see in the report, this isn't surprising. Women make up the majority of Minnesota workers who are paid at or below minimum wage, even with advanced degrees. As we've seen in this pandemic, the work women do frequently lacks the kind of security and benefits, including sick leave, that all people need, particularly when women are the heads of household, which they frequently are. And at the same time, support for caregiving, including affordable quality childcare, has moved increasingly out of reach. And women and girls in these times are having to make that choice. Do they do the kind of frontline work that puts them at risk, or do they stay home to educate their kids and, in many cases, siblings? Do they have to care for older relatives? We see in this report that women's economic security intersects with every other issue of a woman's life. It impacts her health, safety, and access to leadership opportunities. And the first piece of the puzzle is occupational clustering. Isn't that right, Christina?
That's right. So we try to pull out the different components in this report that lead to the economic disparities that women are faced with, and also think about these in relationship to race and place. So in this graphic that we have here, this is the percentage of Minnesota two-year degrees by gender. And we can see already at in educational choices, a clustering of men and women in particular kinds of positions. And occupational clustering is one of the big factors behind the wage gap that we will show you next, because those occupations that are considered more feminine or more caring, we value less and we pay less for these occupations. I think for the salaries in these occupations. And I think when we think about the COVID-19 pandemic that we're facing, all of us recognize that it's healthcare workers, right, that are at the front lines, that are facing some of the most greatest risks in dealing with the disease, but are also among the lowest paid, especially those in the lower echelons of the healthcare system, and those are principally women. This is actually the topic of another report that my center will be releasing later this month on COVID-19, and looking at the dual vulnerability that women and women of color in particular face. But it begins with this occupational clustering. And so this clustering is then one component behind, not the only component, but one piece behind the wage gap that we see in this graph. And here in this graph, you can see the attention that we pay to intersectionality by looking at how different groups by race and gender are impacted by the wage gap. And we pay special attention here to the groups that are most important in the Minnesota context. So for example, it would be easy to think about the group Asian, and then think that Asian Americans do quite well when it comes to wage differentials compared to white Americans. But we know that here in Minnesota, a large portion, the largest Asian group is Hmong, then followed by Asian Indian. And these two groups have wildly different experiences when it comes to the labor market and the wages that they get. We can see a similar, but not quite as dramatically different, but differentiation between African Americans and Somali Americans, one of our other large groups. But overall, when you look at this graph, we can see that Hmong, Native American, and Latina women and Somali women are among the lowest paid in the state. And so this is how the wage gap looks when we look at and take gender and race together into account. If we took, I think the one important point that I want to make in addition to simply looking at these figures is what the lifetime impacts are here. Over a lifetime, we've calculated that women in Minnesota lose an estimated $400,560 of earnings due to the gender wage gap. And now that is for women overall. If we were to break it down and look at specifically Latina women or Somali women, we would see even greater gaps. In this graphic, I wanted to draw your attention to what this actually means. When you have these lower wages, what does that mean in terms of the cost of living? If we take what the typical cost of living is, and that's according to Minnesota DEED, the Department of Economics and Economic Development in Minnesota, a two-parent family with 2 children, the estimated cost of living according to DEED is $86,124. If we look at what different groups, and this is based upon our analysis of American Community Survey data, typically earn in terms of median income, we can see the percentages of two-parent families and single-parent families, single mother-led families, across different racial groups, and see what percent of those families do not have the income to meet the cost of living, and those of which are below the poverty line. So here we can see specifically, even in two-parent families, Native American families and Latino families, 76% are earning income below the cost of living, 15 and 17% below the poverty line. This increases, right, to amounts that are really concerning when we look at single mother-led families with two children in the home. To 100% of Native American women-led families, and 93% of Latina, 99% Black, 93% Asian. Some really concerning numbers that hopefully, as you do your work in Hennepin County, I'm sure that you have experiences in working with families of different kinds and see on the ground what this might mean for them to have these levels of income in relationship to the cost of living in our communities. One more piece to kind of lay out how income is affecting these families. As Gloria introduced this section, she made very clear that when we look at economics, we have to take into account the care aspects of what care of children, care of elders, and that comes with cost. It either means that someone is staying home within the household, either part-time or full-time, but oftentimes, and for most Minnesota families, that's not an option. So then it means finding, in particular for children, but also for elders, care and paying for that care. So the cost of Minnesota accredited center-based infant care compared to that median income for families according to their race, we can see here that, again, this is using those 2-parent families and single mother families, how the cost of childcare outpaces the median income for families of these groups. Now, we don't want to necessarily squeeze the childcare workers as a way of accommodating the cost of families. But balancing that care and income is a major challenge. And think about single parent mother-led families, it's a particular challenge.
Yes, and I would say this is an opportunity to think about how we are paying caregivers and the value that we assign to that. So 94% of childcare workers in Minnesota are women, and they are frankly underpaid. Nationally, women of color, Native American women comprise 40% of the early childhood workforce, and in Minnesota, they represent 15%. And so as a consequence of low wages, over half, which is 53% of US childcare workers, were enrolled in at least one of 4 public supports and healthcare programs between 2014 and 2016, compared to 21% of the entire US workforce. So not only is the occupation low paying with a median hourly wage of $11.98 per hour in Minnesota, but there is a wage penalty for workers who care for younger children. And this is something that is very alarming, and we hope to change as we think about how we value different work.
So in the report, we talk about a number of different pieces. We've just shared with you elements related to education, related to income, but there's a number of different factors that ultimately go into a wealth gap. So we can talk about income on the one hand, but the other aspect is wealth. It's whether you own a home, whether you have savings. And all of these together then comprise what we put towards future generations. So families with wealth are able to withstand, for example, the COVID-19 pandemic if they were to lose a job. Families with wealth are able to invest in the childcare that we just mentioned, and also a college education. Families with wealth are able to feel that they are safe from eviction if they own their own home. So these are the education gap, the income gap, the inheritance gap, and the home ownership gap all lead to the wealth gap over time. And there's a gender piece to that, though there's also a very large race element to that. The home ownership gap is principally one in which we see a racial dimension, but we also see it when it comes to single women-led families. The income gap, as you saw, is race and gender working together.
Yes, and I would say that the accumulation of disinvestment in communities really compounds over time and increases those disparities. And so wealth becomes wealth is more unstable for non-white groups. Wealth overall has been very stable for white communities over generations across our state, but that same cannot be said for communities of color. And so this really points to the systemic causes leading to the lack of intergenerational mobility. So we'd love to see your reflections and questions that you might have in the Q&A box. So if there's anything that occurs to you, please type it in there, and then Sarah can share that with us. But you might want to think about how data like this informs your work within Hennepin County and the work that you're doing on the ground.
Yeah, that's one of the reasons we were so enthusiastic about coming today, thinking about to what degree these kinds of data could actually help inform the work that you're doing. And we'd like to really hear from you about that, about your experiences, but also what might be useful to you out of this data. So the second major portion of the report focuses on health and the impacts of disparities of health on women and women across races. and across place in Minnesota. We can see today with the COVID-19 pandemic, it's become to the forefront the fact that disparities of underlying health conditions are having larger effects through higher death rates to COVID-19. That's especially impacting communities of color. And in this report, which we completed prior to COVID-19, and which we do on a regular basis, we have shown over the years that these disparities, these underlying disparities that we now know are having an impact on COVID-19.
What I would add to this is that when we think about health, we are seeing, particularly in young people, that they're facing challenges with mental health, which can ripple into physical health issues and the choices that they're making. We're seeing these health disparities not just as issues for communities of color, but the rural communities of our state that are lacking access to significant health services. So prenatal and reproductive care are ones that come to mind especially. The 10 counties with the highest teen birth rates are all in greater Minnesota. Youth in rural Minnesota may face more difficulties accessing sexual health clinics due to barriers including fewer clinics, longer distances to travel, limited hours of operation, and confidentiality and privacy concerns. So of all our rural Minnesota counties, 47.5% have no sexual health clinic, while Hennepin County has 18. Another component of health access that we want to talk about is maybe on the next slide.
Yeah, on this slide, these are just some bullet points drawn from the report. We have many more, but these are some of the more concerning ones, and they're drawn from the Minnesota Health Department, the American Cancer Society, and some other sources. But we see Native Americans have a 50% higher mortality rate from heart disease than white Minnesotans. Minnesota women of color and Native American women are at greater risk than white women from developing and dying of certain kinds of cancer. And stroke deaths in Minnesota for women is higher than for men. African Americans and Asians have a 40%, and so that's men and women in this case, have a 40% higher stroke rate than whites. So some of these impacts come from the economic aspects that we were talking about previously. So ability to live a life that's stress-free, and economic impacts can cause high degrees of stress. Past trauma due to discrimination can also lead to health impacts. So some of these disparities that we find in the health section, we know are related to the economic disparities that we spoke about before. They're also related to access to health care, right? And problems with structural racism within our healthcare system. I mean, I think that is something that we've seen raised in the media, importantly, that needs more attention now that we're in the COVID-19 context. This data is from American Community Survey data, CWGPP's analysis of it, looking at how Minnesota health insurance coverage rates have changed over time. So when we think about, most of us are familiar with the fact that the ACA increased healthcare coverage. Minnesota was one of the states to take part in the ACA expansion. And our expansion in this state began in 2013. And you can see in this graph how then there was an impact in terms of increase in health insurance coverage. And what that has meant across different groups, with greater gaps for Native Americans and Latinos, somewhat still a gap between Blacks and whites, less so between Asians and whites. And what we have in terms of a concern here, we don't know if this will become a trend, but we did see at the last data point in 2017, a drop in coverage. This may have to do, according to our sources at the state, they think that this is due to a reduction of choices in the private marketplace. It may have to do with some of the erosion of the ACA. So, but healthcare insurance, of course, is one also important aspect of dealing with the health disparities. And then I wanted to point out in the health section, one final piece, though we have much more in the report itself. And this relates to some of the mental health aspects that Gloria had mentioned in the introduction to this section. And we looked at data on Minnesota students and rates of attempted suicide. This figure is completely new, not in our previous reports, and frankly shocking, the rates of suicide that we're seeing among Native American girls and Latina girls. This is something that we definitely would like to understand better, what is going on behind this data that we have found.
And this is the reason that we work upstream to address community well-being on a holistic level, to include programs that are investing and building the blocks of women, for women to achieve economic security. We at the Women's Foundation have what we call a Girls Best program, building economic security together. And then we have a partnership with the state of Minnesota, the governor's office, on a Young Women's Initiative, where young women identify problems and solutions in their communities. So hopefully working upstream will help to combat some of these results.
I have one comment that is fitting for the health section. Susan noted that there's a distinction between a clinic and a high quality adolescent friendly clinic. And the Better Together Hennepin initiative works with clinics to achieve the latter, of which she knows there are fewer than 18 in Hennepin County. And then we have another comment that kind of touches back to the education section, but obviously tied throughout, that one attendee noted that supporting families with education access can be complicated by other factors like transitional housing and lack of secure internet access.
For sure. Absolutely. I mean, that's just those are both that's a wonderful comment. This last one on the intersectionality of the issues, right? Like they are so complex and overlap. When we think about Hennepin County improving health disparities, I mean, some of the things that we think could be done is, we could improve air quality where communities, for communities, we could look at our food deserts and work to ensure that everybody has access to affordable, healthy food. We can ensure that communities have access to preventative and regular health care, and we can support young people so that they know their value and see pathways to economic security and have a vision. And we know there's no greater motivator for achievement than hope. And that is something that we continue to encourage for our young folks.
We do have one question too. A participant noted, although there needs to be more parity between economic sectors, for example, childcare versus technology, would you say that it is important in particular to support education for girls and women in order to access higher paying jobs and then all of the positive impacts that might domino from there?
I would say, I think that's a great question. And certainly education and the choice of where to pursue one's education then can lead to that occupational clustering. When we look at education writ large, we see the wage disparities actually increasing over the course of greater education. We also know that when it comes to college, now for some time now, women have been the majority of college graduates. So it's not necessarily a panacea in terms of addressing the wage gap overall, but we do need to see more women and girls moving into STEM areas, in particular, the technology areas that are the growing areas of the economy and which are high paying.
Okay.
All right, should we move on to
Yeah.
our next section on safety?
Right. So overall, violence is a reality for far too many women and children in Minnesota. We know we've heard this at this time of COVID, where we're supposed to all be sheltering in place and staying healthy. This isn't the case necessarily for all women. And so we'd love to know what you're seeing at the county level in terms of what you're hearing from families about their safety or the safety of children.
In addition to the COVID and work report that my center will be releasing later this month, we're also working with a team of epidemiologists at the School of Public Health on a report specifically on COVID-19 and its impact on gender-based violence, especially domestic violence within homes. We know, of course, the stay-at-home order meant it might have been more difficult for victims, survivors within households to find a place to leave when faced with an aggressor in the home. Calls to statewide day one domestic violence hotlines were up 25% over last year. And so there's big impacts in terms of COVID-19 on victims and survivors, and the capacity, the ongoing capacity of providers to serve those that have been impacted by violence.
Right. And what we've heard from our grantee partners is exactly that home has not been safe. And so we've been trying to provide support to those organizations through our COVID response fund for women and girls. And we know that in particular, LGBTQ youth who have potentially been forced to go back into the home have also reported feeling unsafe. And so recognizing that we need to address that is really important.
So in this report, we find, in the status report, we find that 1 in 2 Minnesota women report sexual violence and 1 in 4 report physical violence from an intimate partner at some point during her lifetime. Another one of our statistics is that we could fill target field almost 18 times with the number of Minnesota women who have experienced rape, physical violence, or stalking. And these numbers have not changed over the course of time when we have done this report. They actually appear slightly higher in this report than previous reports. Overall, we're not seeing a diminishing of gender-based violence in the state. And I'm going to move to our next slide here on the specific impacts of LGBTQ youth.
Yes, and of course, as we've seen this summer, too many people across the state don't have homes, and we know that LGBTQ are a big part of that.
Yeah, so LGBTQ youth are overrepresented among homeless youth in Minnesota. LGBTQ youth are more likely to run away from home due to issues within lack of acceptance in among their family members. And then they face significant risk of sexual exploitation and other forms of violence on the streets and homelessness. So this data comes from the Wilder Foundation. So every time we put together the status report, our data on homelessness, it's really their survey that they regularly do has been critical for us to look at the differentiations, both by gender and LGBTQ individuals.
So when we think about, we'd love to know again how you see intersectional safety issues in your work. And at the foundation, it's really important for us to center the communities most impacted in the solutions and invest in their wisdom and leadership. So we are investing in programs that encourage healthy relationships with boys as well as girls. And so, as an example, one organization is Casa de Esperanza, where we were working with girls, and the girls asked why they were having to do all the learning they wanted to know where the boys in the relationships were being educated about their behavior. And so then CASA adapted in their programming their curriculum to include boys as well, increasing the impact for the whole community. And I would say through the Me Too movement, we've seen the bigger work of changing gender norms about what we teach our children and what it means to be a man and a woman, and to think in non-binary terms, and really working with individuals to role model, leaders in the community to role model the importance of representation, and role modeling healthy manhood and unrestricted pathways for all genders.
So we do welcome your questions and comments on this part as well. I would say that we do have more data on the report that's more on a national level and a little bit on a state level in terms of the view that Gloria just presented of really thinking about gender-based violence as not just a problem of women, but a problem of men. We need to start looking at the source of where these attitudes that we have in society that then lead to it being seemingly okay to commit violence against women. Our last section of the report is leadership.
Yes, and when we look at this area of the report, we actually do see some progress and definite areas where we can improve, especially when we think about how institutions can help move the needle and create a stronger workforce for the future we want to see. And we've all seen remarkable leadership on the front line here in Minneapolis and at the center of movements for climate change, racial justice, and community policing. And this year alone, of course, we have seen our first Black Asian woman nominated for vice president. And we have in Minnesota the highest ranking Native American woman elected to executive office in the United States. And so Peggy Flanagan is providing leadership here in Minnesota. And we're very excited that she's partnered with the foundation on our Young Women's Initiative. So she is the co-chair of that initiative with me. And I know she's very enthusiastic about how she can bring leadership for the community so that we can center women and girls across the state, again, to identify the problems and solutions in their communities, recognizing that it's different across the state. I would also say that in 2018, we saw historic wins in the midterm elections for Black, Indigenous women of color running for office. And I are very proud at the foundation of the fact that we actually had a couple of women who were involved in our Girls Best program and in our Young Women's Initiative who are now city council members across the state in some of our cities. So very happy about that.
Yeah, so we've been tracking in the leadership portion of the report, we track political leadership, also leadership in the private sector, in business, and in the nonprofit sector. So we did publish the report before the latest elections. So the graphic you see here is through the 2020 state legislature. And as Gloria said, in that 2018 election that led to the 2019-20 legislature was our best in terms of women of color. It was a flat line in terms of women overall in the legislature, but we saw a growth among those women of color. And here you have the specific numbers. The most recent elections, I'm excited to report, we see an increase in women overall and a bit of an increase of women of color too. So okay, at least this is according to our calculations at the Center on Women, Gender, and Public Policy. That may change because there's still a few contested seats, and so there's some recounts going on. But it looks like we will hit even with the 2007 was our last record high of women in the legislature, in the Minnesota legislature. It looks like we will meet that record and hit 35%. All the women of color in this that are accounted for in this graphic maintained their seats, except one that moved from the House over to the Senate. And into the House, we have 3 new women of color and 1 new male of color, 1 African-American, 1 African descent, and 1 new Native American women representative. So this last election was pretty good when it came to women and women of color, but you can still see from this graphic, overall, if we take all different ethnic groups, women of color and Native American women together make up 10% of the state's population. We're far from that in terms of actual parity, in terms of representation. So there's still more work to be done. And of course, women aren't 35% of the Minnesota population, they're 50. So more work to be done in this area, but some good news from this last election.
And when we think about corporate leadership, although we can see that women's representation among Minnesota corporate executives has risen in recent years to 21% in 2018, at that rate, at the current rate, it would take 52 years to reach gender parity. And that is a stunning statistic. And that is why at the Women's Foundation, we are investing in young women, because it really is about a pipeline issue, right? Preparing women to lead and to run in their communities and investing in their leadership today.
We don't, unfortunately, have data, have not been able to collect data. It's not readily available within the state sector. So folks like you. So it would be interesting to know what your impressions are, or if you have sources of data, we would love to put it in the next report to understand in the state sector, not necessarily elected leadership, but leadership in places like Hennepin County. How diverse is it? And we do wonder to what your experience has been when the composition of government leadership changes, when it is more representative, when it is less representative. What kind of difference does it make for the work that you do? And that actually closes out our conversation more generally, so we can open it up to questions that you may have about the data, about more details. As Gloria said in the beginning, this is just a sampling of some of the data that we gather for this report.
Thank you, Dr. Ewig, for your great work. It really is very helpful to us as we are going around the state trying to get investments in this work. The data makes a difference.
To our attendees, if you'd like to submit a question, we are ready for those. If you have any questions or comments that you'd like to share. And I will also be sure to include a link to the 2020 report in the email that I'll send for follow-up this afternoon. So you'll have a quick and easy access link to be able to read more of the report.
And I'll just jump in here too and say to those of you that are listening in and might have questions, I would like to hear whether or not you think it has made a difference that the county board has more women representing their areas than in the past. So, and maybe that doesn't really make a difference. But I would really like to know if you think that that makes a difference, or does it have to be more on the department head or manager's level, or what would make a difference at the county?
I'd love to know the answer to that. And
Yes.
county boards across the state have been, unlike other parts of the state, we have been able on occasion to get data on that, and they've been predominantly male. So male and white. So that's a great question. How much does it matter?
One of our attendees said enthusiastically, all of it makes a difference. So
Thank you. That's terrific.
I think it is important.
to just build on that really quick, we had a conversation with men about their role in women's safety recently at the foundation. We hosted a series of 3 conversations with men, and they really came to an expanded understanding that it's fewer men who actually are perpetrating acts of violence and larger numbers of men who are complicit by standing and allowing discrimination and abuse to happen without speaking up. And so as a result of that series within the foundation, we're starting what we're calling a men's circle of courage, where these men will continue their learning and develop a community of practice about how they can partner with women to create a world that we all want to live in. And I think to that point, they as individuals feel that that will enrich their lives as men, whether they were men of color or white men. They really felt that that will benefit everyone. So
We have one more comment from Latanya, shared that they'd like to see more people of color in Hennepin County, in particular in probation, and the importance of that area being more representative of the clients that the county serves.
thank you. That's a great comment.
Yeah, that's crucial, especially when we know the disproportionate numbers of people of color going through the criminal justice system, women of color included. I have a student working on the topic of Native American women in our criminal justice system here in the state, and they are disproportionately incarcerated. So it's quite important. We also know from the research on representation that by having diverse individuals at the table and diverse within groups, so we don't have the African American person speaking for African Americans, but you have a number of African Americans with different kinds of experiences at the table, makes a difference for what gets discussed and what is dialogued. And it's part of being a more democratic society, right? By having those voices heard and at the table.
There's definitely agreement hearing in the chat that absolutely that it's important to tap into life experiences that enrich the workforce. And another attendee said that they think it makes a difference, but we need to see progressively that positions grow at all levels to see an overarching change, that like a board at the county level can make a large change, but to build an environment of acceptance, legacy, and power and accountability, they'd like to see it in every team and department leadership as well.
Yeah, and to that point, I wanted to pick up on something that Gloria, you said, like about how, like with regard to leadership stuff, you're focusing more on younger women, and well, representing another part of the population. I'm thinking, well, why would you focus on younger women? I mean, why not across the board there?
Well, that's a great question. I think it really is about sort of the deep-seated acculturation that we experience. And with your question, Kathy, about does it matter to have women, a majority of women on the Hennepin County Board? It does, but it also matters. So it's probably more of a both and. But what I was going to say is that it also matters that within departments that there are succession plans where leaders are preparing that next generation and providing exposure and opportunities for more education, so that younger employees with diverse lived experience can ascend into those leadership positions. So I think it's a both and.
Mm-hmm.
Don't see any other questions or comments at the moment, but I'd like to welcome any attendees to send us one last comment. We just have a couple minutes left. Any other questions or comments? And If not, please be sure to look for that email from hup@umn.edu to all of our participants this afternoon with a brief survey. We'd love to hear your feedback. And also please feel free to email us. I'll share the contact information for our presenters. The HUP is always here to take your ideas, suggestions, feedback, and I will include a link to the copy of the 2020 Status of Women and Girls report for a chance to read more about some of the things we've heard about today. So another comment just said, thank you for sharing this information. It was very interesting and educational. I agree. We'd like to say thank you again to both of you, our presenters, for joining us today. And to all of our attendees, thanks for joining us. And we hope to see you all again soon.
Wonderful. Thank you.
Yeah, thank you for having us. It's been important to be able to speak to folks in Hennepin County.